My most common body contouring procedure is a tummy tuck or abdominoplasty. The typical patient who I see for this procedure is a woman who has finished having children or a man or a woman who has lost a significant amount of weight. Both of these situations can result in an excess of skin and fat of the abdomen. If there's only excess fat of the abdomen with no excess skin, liposuction only may be the best bet, but this video will concentrate on tummy tuck. A tummy tuck removes excess skin and fat and tightens the muscle layer which has been stretched. Skin has a certain amount of elasticity, and this depends on heredity, skin type, age, and weight. Most women who have children or lose weight end up looking amazing. They have not exceeded the skin's elasticity, and after being stretched, the skin snaps back like a rubber band, and they look pretty much like they did before pregnancy or weight loss. I never see these folks. The people who come to see me have situations where nature was less kind. Their pregnancies, aging, or weight loss have resulted in skin that was stretched beyond its elastic potential and cannot snap back. It may have internal scars, also called stretch marks, or it may just stay as loose skin that often overhangs the pubic area and makes the belly button look unattractive. When a C-section was needed, this looseness looks even worse because the C-section scar becomes a fixed point that often doesn't allow the skin to redrape normally. Most women who have great skin that hasn't been overstretched often may need help to fix the area around a C-section scar. I look at a tummy tuck as a rejuvenating operation, much like a facelift. A facelift typically makes the patient look younger by about 15 years. A tummy tuck restores a youthful appearance to the abdomen, returning it to how it looked before pregnancy or before weight loss. So, what is a tummy tuck? Basically, a tummy tuck is an operation that removes all the skin between the belly button and the pubic hair, tightens the underlying muscle, and has the belly button exit the skin in its original position, which is now located much higher on the skin. When patients think about a tummy tuck, they are obsessed with the scar. Literally, the scar is the major concern in almost 100% of my patients before surgery. I'm concerned too. I want the scar to lie low so it can be covered by a bikini, and I want to give the patient the best possible scar. We have lots of techniques to achieve this. I find it fascinating that after surgery, even when the scar is at its worst, the patient looks at the tightness, the improved contour, and the rejuvenating effect, and no one cares about the scar. They have the abdomen they have always wished for, and they feel the scar is a minor price to pay. All of my tummy tucks need a 360-degree fat removal, with liposuction done posterior at the same time of the tummy tuck. I've done this for over 20 years, and when I see a patient who have not had this extra step of liposuction, the results are often disappointing. Not doing aggressive liposuction can result in bulging at the edges of the incision and in an abdomen that looks too flat compared to the back and flanks. Tummy tuck is a significant operation with a significant recovery. The surgery itself takes about 2.5 hours. I do all of my tummy tucks as outpatients, meaning they can go home afterwards. We can arrange for you to stay at our carriage house with a nurse for the first night, but most patients want to go home. There are drains that are placed that need to be cared for during the first week. There will be some discomfort, which we will provide pain medicines for, and usually a pain pump. Most women who have had a C-section find that recovery from a tummy tuck is very similar. Most people take 2 weeks off from work, and there is no heavy lifting allowed for 6 weeks. When skin stretching is minimal and is located only below the belly button, a mini tummy tuck is possible. This is an option in only about 5% of the patients who come to see me for issues regarding their abdomen. Recovery is shorter, and results can be just as good in the right patient. Every procedure has risks, and these will be carefully reviewed at your appointment. Although abdominoplasty is a significant undertaking with significant recovery, abdominoplasty has an extremely high satisfaction rate and is an excellent operation that can give dramatic improvement to the abdominal area.